안녕하세요. Distinguished guests, thank you so much for inviting me. I'm very honored to be the first speaker, opener of this conference. The title I chose for this first presentation is Whither, the Care Economy. What is it? Where is it? What is the status? When we last met here, we were thinking about the care economy as really the invisible economy, not visible to, especially to people who care a lot about the productive sectors. But notice that during the pandemic, all of a sudden, this invisible care economy became so much more visible. We understood that as formal institutions, firms, schools, universities, lots of these organizations and institutions closed down because of the pandemic. We realized that the importance of what we were calling the invisible economy came to save the day. And really, so we're discussing today the care economy, which is now much more appreciated and much more valued. I was going to say something about what it is, what is the care economy, but because of the excellent introductions by the Dean, by Professor Un, by Mr. Che, I'm going to forego that for the sake of time. And I'm going to go to the first part of my presentation. So care needs have been increasing, but diversely due to different patterns of demographic and epidemiological shifts. And by this, I mean to say, one, population and disease projections say that that life expectancies have been growing, but have been increasing, but also that healthy life expectancy is quite different than just life expectancy, let's say at the age of 60. So different population patterns exist across countries. For example, the differences between the middle-income countries, where most of the world's population live. They are young, but future demographic dividend, because of falling fertility rates and increasing working age population, will actually bring us all the demographic dividend. That's what I meant to say. Low-income countries, mostly in Africa, have very young populations. Population rates there are above 3% still for many countries. And then high-income countries like South Korea are aging and will continue to do so. So these are patterns that we see. Let me just go quickly through this because the next presenter, Dr. Floro, will actually be speaking a lot more in detail about the demographic shifts. So declining birth rates means fewer family members to care for the relatives and also a smaller working age population. These are patterns and trends that actually are very important for the economy. The implications are increasing reliance on professional care services, but also fewer taxpayers who will be paying for the expenses of government for formal care institutions. Let me just show very quickly these age composition of the world that is changing, comparing 2025 and 25 years later, 2050. We see that the age at those who are age 20 will be increasing. Those who are above 70 and above will actually be increasing for the world as a whole, and quite a bit more, reaching 2.1 billion by 2050. That's a huge increase. But what we see is also that the least developed regions of the world are going to continue to be the youngest in the world. They will be growing their young people and therefore also growing their workforce. this is something that have both positives and negatives in terms of the care economy. So negative because there will be very young, much younger people, many more, but the positive will be that that means to say their workforce will be increasing. All this come to certain trends in the dependency ratios in these countries. They will be rising in all world regions except in Africa. If you look at the column on 2010 or 2030, actually we're closer to 2030, and then compare that with what these dependency ratios will be in 2090, we see really that the dependency ratios will be increasing in all regions, but declining slightly for Africa. I already spoke about the life expectancy and the difference between life expectancy at age 60 and healthy life expectancy at age 60. These are adjustments due to what we know about about diseases that will affect people as they reach age 60 and above. So the average life expectancy for those who will reach age 60 has been increasing worldwide, but the average expected healthy life years are far less. Still increasing, but much lower. Here's the composition of causes of death between 2000 and 2019. So here we see a change in the world about where deaths are going to come from. So at many decades ago, communicable diseases are the diseases that account for many more deaths. But as countries increase, as the income of countries increase, also as people age, as they actually survive and past age 60, it's non-communicable diseases, cancers, it will be cancers and cardiovascular diseases, for example, and injuries. Those are going to be the more important reasons or causes of death. So the macro changes that affect the future care demand are care needs that are increasing in many countries, but as I said, diversely, due to different patterns of demographic situation and health shifts. So we need, since we're talking about an economy, we need to think about what are actually the factors affecting demand. So the care needs will depend on demographic shifts and health shifts. They will also depend on public health improvements, on medical advances, on economic growth, and those have reduced the incidence of communicable diseases worldwide. But, as I said, non-communicable diseases have become more important as incomes grow and population age, especially in middle-income countries. But what will affect supply? What are the supply factors? So we need to think also about these macro changes. How much of care needs are provided by household or family members? And it's really the changes in the prevalent household structure that's very important for understanding who is in the household who can provide care. Are households more nuclear? Are they STEM household structures, or are they more extended household structures? And different countries have different prevalent household structures. I imagine that, I know in South Korea, it will be nuclear families. That means mother, father, or just the parents and a child, if a child is there, rather than parents and other relatives also being there. Now, time use data revealed that the burden of care, and this is the intensive margin of care. This is called how much time is actually spent on the care. The potential burden of care is very much borne by women, men, and children, something that the previous speakers have already mentioned. What happens to the labor force participation of women in particular is very important because women have been the primary caregiver. What are the shifts, shifts in social norms and behaviors about caregiving? We should not, when we talk about demand and supply, we should not forget that the preferences of individuals and households and communities are very important. And of course, government social policies. So let me just talk a little bit about what we mean when we say care provision. And here's a very simple way of categorizing the care supply or care provision. Two big categories, formal care and informal care. Under informal care, or under formal care, institutional care and residential care. These are paid caregiving. And then we have informal care, which we usually call the unpaid care. But actually it's unpaid household, but it could also be paid care, but paid care that is in the gray sector because they're unreported and unregulated. When we talk about the care economy, here's a very simple way of diagramming this economy. We have the public sector, we have an unpaid care sector, the formal care, paid care sector, and a gray care sector. With each of these bubbles in this economy having a different function or different roles. And I have put down here, for example, for the public sector, it would be policy, financing, and direct provision. The percent of countries with laws regarding care provision, this is very important because they determine what is the legal framework, the legal environment for care. For example, what do we mean by these laws? Examples are paid leave of at least 14 weeks available to mothers, leave benefits for mothers, paid leave available to fathers, form of government support for families, and so forth and so on. And so this was a data source on women, business, and law. I got this information about for high-income family countries, upper-middle countries, and so forth. And you can see that these are the percentages of the countries within these categories that actually have these laws about these areas. And here's legislation about care provision in selected countries. So instead of just the income groups of countries, let's talk about South Korea, Japan, USA, Thailand, and the Philippines. And you see where the yeses and the nos are. And probably more important to look at where the nos are. So Thailand and the Philippines have more nos in terms of legislation about care provision and tells us where we might need to go. So as I said, now the unpaid care sector, these are the functions of the unpaid care sector. These are the intra-household and inter-household child care, elder care, care for disabled people, financing, advocacy for care economy. These are some of the functions of the unpaid care economy. And this is just from time use surveys and the daily hours on unpaid and domestic care workers. I'm in a bit of a hurry, so I'm just going to go through this. During the pandemic, you see a huge difference. So the length of these, each of the bars tell you the difference between the daily hours spent by mothers and daily hours spent by fathers on unpaid care out of all the work that they do. So quite different from most of the countries. So the COVID-19 pandemic really revealed our dependence on the family for childcare, and especially on mothers. This is something that was quite interesting. I told you about the importance of social norms. So if you look at the survey called the World Values Survey, there are two questions I want to discuss. Duty towards society is to have children. Do you agree or do not agree? And here's a comparison between 2017 and 2022. Actually, I did not, no, this was just for that period, right? So you see for Japan, Thailand, South Korea. So you see agree, which is the orange line, to disagree. And you can see the total fertility rate. And Dean Shane already mentioned the very low fertility rate in Korea, despite the fact that Koreans actually think their duty to society is to have children. So there's something else going on here. And I don't have the time right now to discuss that, but I have read a study which actually tries to explain that. Here's another one. Is it children's duty to take care of ill parents? And here again, the answers are agree to disagree, and all the way to disagree. So you see that for most of these countries, these are Asian countries, family values about childcare is actually for children to take care of ill parents. All right. Formal paid care, provision of caregiving, financing, and innovation. These are the functions of the formal paid care. And then let's go to the gray sector. Also, so again, to remind you, the gray sector is the sector that's likely paid, but it's unregulated. And some of this could be cooperatives or neighborhood or community centers. People make contributions, but don't really pay, let's say, minimum wages. And they are not regulated. In different countries, the size of these bubbles will be different. In the richer countries, you can imagine that the public sector, as well as the formal paid care sector, which includes the business firms, will actually be bigger than in countries that have a smaller formal sector in the economy.
I wonder if we could...
Yes, I'm ending. This is it. This is the last.
Sorry.
So the care sector is a large part of every economy. I lied. One more. Just one more, Ito. So I want to challenge all of us who care about the care economy to actually put a number to the contribution of the care economy in the whole economy. And what you see here for the US alone, and this was done because of the COVID pandemic, is this says it's worth $6 trillion and larger than the US pharmaceutical industry. That is actually quite amazing. All right, thank you very much. And hopefully there will be questions that will allow me to present the other ones, the other slides. Thank you so much.
Thank you very much, Beth, for your really excellent presentation and your discussion about the macro and global changes in the care economy and their implications for families, community, government, and public policies.